Hey, everybody, it's the Glockenfleckens. We are bringing our live show, Wife and Death, to Boston. We're coming to the Huntington Theater September 14th, just right around the corner. We cannot wait, especially because we're coming to Boston before it starts snowing.
Theoretically, yes.
Hopefully, it's going to be great. It's going to be great weather. Come on out. We can't wait to see you. Get tickets now, glockenflecken.com/live. We'll see you there. Knock, knock. Hi. Welcome, everybody, to Knock, Knock. Hi with the Glockenfleckens. I am Dr. Glockenflecken, also known as Will Flannery.
I am Lady Glockenflecken, also known as Kristin Flannery.
Thank you all for joining us today on this very special episode we have with a good friend of the pod.
Yes, one of my favorite humans on planet Earth.
Rana Awdish.
That's right, Dr. Rana Awdish.
So Dr. Awdish is, she does a lot of things.
Mm-hmm.
She is a best-selling author.
Yes.
In Shock.
That's right.
Give people like a 3-sentence summary of In Shock.
Yes, In Shock is a landmark medical memoir. If you are in medicine and have not yet read this book, what are you doing?
Incredible.
Stop everything, go read it. She is a critical care physician who I think it was her very last day of fellowship, became a critical care patient.
Yeah.
And In Shock details that experience and how being a patient in her very own department taught her, what that taught her about medicine. And that was actually one of the books that was very healing for me in my own co-survivor experience after your cardiac arrest. Finding, her book and seeing that a physician saw all the same gaps in the healthcare system that I had just experienced. And it was very validating. But it's also just like a really riveting, fascinating, insightful book. And that was her first book. And now she has a second book.
Her follow-up, Aftershock, which is the full title is Aftershock, Learning to Reinhabit My Body After Illness. It's been described as a piercingly honest, insightful, deeply vulnerable examination of the true nature of healing. And during our conversation with her, we talked a lot about healing and how healing can mean a lot of different things to a lot of different people, and just hearing her insight about it.
Yeah, and especially that medicine doesn't own healing. I think that is a really interesting conversation to be had for a bunch of healthcare professionals.
And just in addition to being an author, she's a clinical professor at both Michigan State University and Wayne State University School of Medicine. She's received numerous awards, both for being her work as a physician, but also as a writer. And lots of op-eds. Anything you see her write, go read it.
Read it immediately.
If it pops up somewhere,
yes,
check it out. And definitely check out her book. So should we get to our conversation with Rana?
Yes, let's go.
All right, here we go. Dr. Rana Awdish. Hey, Kristin, remember how you love eyelid mites now?
Mm-hmm. Sure.
Well, there's a lot of confusion out there. I want to clear something up.
Okay.
All right. People think they can get eyelid mites from dogs and cats.
Can they?
No. These particular Demodex mites are specific to humans.
Okay.
So spread from dogs and cats is not expected. That's a myth.
Can't get them from cuddling our poodle.
No. Demodex mites that cause blepharitis live on humans. Most adults already have them. They just usually don't cause problems. It's when they overgrow that they can lead to itchy, red, irritated eyelids. Those little collarettes.
The crusties at the base of the eyelashes. Right. And the good news is there's a prescription eye drop available for Demodex blepharitis.
That is great news. To learn more about eyelid health and Demodex blepharitis, visit miteslovelids.com. Again, that's miteslovelids.com to learn more. This ad is brought to you by Tarsus Pharmaceuticals. We are very excited to tell you about a healthcare news podcast that just came out. It's called Medlines.
See what we did there? Medlines, headlines.
That's good. That's good, right? It's a weekly wrap-up of everything in our field, from breakthrough discoveries to research, politics, pop culture.
Yeah, I think the best way to think of it is kind of like NPR's Up First podcast, but for all things healthcare.
And we're excited to be a part of the team behind it, along with our partners at Human Content and our inaugural sponsor, the New England Journal of Medicine.
Yeah, we wanted there to be a podcast out there for busy healthcare professionals to stay informed on the go without taking a big chunk out of your day.
It's the episode's like 15 minutes.
Yeah, or less.
That's like the length of a cataract surgery.
Exactly.
Episodes of Medlines are out now wherever you get your podcasts, with new episodes out every Friday. Check it out. All right, we're here with the one and only Rana Awdish, our good friend. You can come on. You don't have to write a book to come on the podcast.
True.
Like, that's a lot of work. It's a lot of pressure to put on yourself. I know that's why you wrote the book, was so you could get on this podcast.
If I knew that, I wouldn't have done a whole second book just to hang out with you guys. And here we are now.
So right before we started recording, the first thing we talked about was how much we both hate self-promotion.
Yeah. It's awkward.
Yeah. And so we're going to talk all about your book, but let's talk about like this. Let's skirt around it and talk about the things that go into like the extra stuff, because you and I both like the creation aspect of it, right? And then is there like a realization once you've like finished the book, they're like, oh, now I have to sell this thing?
Absolutely. And even worse realization, this thing that I was writing to try to sort through my thoughts, like everyone can read them now. I think I do a lot of self-delusion while I'm writing in order to get the truthiest truth on the page, and that works for me. And then I have to come to terms. So if I were writing with a full awareness that my patients might read it, my neighbors, my mom, my son, my husband, I would self-edit in my head almost involuntarily. I would think about how it would sound to other people. I would think about how their thoughts about me might change. So I almost have to delude myself into believing that this is just a process that I'm going through to understand something better. And I enjoy that process enough that at the end of it, I'm like, oh, I do want to share this. I do think it could help other people. But if I knew that from the beginning, I think I'd be a little bit paralyzed.
Are those subconscious thoughts ever realized? Like you're like, oh, I should not have actually put that in this book. Is that? Have you ever felt that?
See, it's week one, man. Like,
how's your marriage going? Is everything going okay? Doing all right?
So, Randy clung hard to the fact that he was really the hero of book one. That was a big identity formation thing for him.
Yep.
And for 2 years, every week I told him, you're not the hero of book two. Like, prepare yourself. And he was like, am I the villain? I was like, kinda. So when he finally did get to read this one, he felt, I think, actually pacified, because I had really kind of built up the fact that he should prepare himself.
Right. Like almost oversold. You're not going to like it, man.
Well, do you want to, I don't want to give away everything in the book, but do you want to like touch on that a little bit?
I really related to Randy, obviously. I mean, that's not a stretch, but
co-survivors, man.
Yeah, exactly. And all the logistics and handling everything and trying to like keep this sense of control and order. And it's like, you don't need a psychoanalyst for this.
And how thankless some of that work is, and how often as the patient, it doesn't even feel like enough because there's some unmet need that you can't articulate.
Yeah, it's a weird job description. That's for sure.
Doesn't pay well either.
It doesn't, no.
So were you thinking about this book? First of all, it's called Aftershock, Learning to Reinhabit My Body After Illness. So In Shock comes out. What year was that you wrote?
2017.
And when was it you were like, there's a lot more to the story that I need to get out there?
After COVID. I think COVID was kind of this great unmasking in a lot of different ways, both about medicine and about our interdependence, and my own health kind of changed during COVID as well. And I sort of felt that writer thing click in where I started paying attention to things differently. I started noticing things as if they were storylines that I was living through and kind of thinking about plot and placement. And that's when I knew another book was coming.
Mm.
I'd also written a bunch of essays around that time, and my first pitch to my editor was like, "Can I just staple these together and we'll call it a book?" And she was like, "No, we can't."
Not how that works. Yeah, so I have had this book in one form, or I have it now in 3 forms.
Oh.
I have had it in one.
So she was on the drive because we just got back from a trip. You were reading,
I was finishing it
and listening.
Yes,
and note
taking. I have ADHD, so it keeps me on track.
That's brilliant. I love that.
I do. I like to have both, like the physical book, if possible, and then I can write my little notes in it, and then I listen to it like somebody's reading me a story time.
If she could smell your book,
I do.
If you had smells associated with it, smell the hospitals, the anger and frustration coming through as a scent.
Scratch and sniff was proposed. Yes. We shot it down in the end, but it was on there.
Wait, go ahead.
I can't imagine why you wouldn't want scratch and sniff in the bowel obstruction section, for example.
I didn't mean to interrupt you. What were you?
Well, now I don't remember. Did you just hear me say I have ADHD? I think I know where I was going. I've had it for a long time, and I have read. I got the super secret sneak peek. I forget what you call those things. They have a name. Advanced reader copy. That's what they are. And I started it there, I don't know, several months ago. And I got the first time I cracked that open, I got through a note to readers. I was already bawling, and I sent Rana this really long message. So that's how this started for me, and that's sort of how it went. I had to take it in bits and pieces as I went. So I was finishing it up on this trip, and I'm still a little verklempt. So pardon me, but there's something about your writing that, for me, and I think for a lot of people, I can only speak to my own experience. You somehow, I wish I could articulate this better, especially this being a podcast, but you somehow make other people feel seen and cared for in how you write about your story. That's the thing that always gets me personally about your books, is just you have a way of putting into words the things that people are experiencing or feeling and maybe haven't even fully consciously, processed for themselves. But even when you have, it's hard to explain, and you just you put it into words, and then not only is it in words, but they are beautiful words. And then there's these artistic themes, and it's just listen, I'm not religious, but if I were, I think that you are the closest thing to an angel on earth that I would ever experience. My personal one, too, because you're a little sassy and dark, which I like, but also the most beautiful human that does the most beautiful things. So that's my girl crush soliloquy.
Thank you. I really thought you were going to go for cult leader. I'm the closest thing to...
That's where I thought that was going.
I really saw us living on a commune together.
Let's do it.
Leading, right? We can do this. No, that's beautiful.
Have you started recruiting? You started recruiting around Henry Ford.
It's sort of been a dream of mine that we could all live in little mini houses with a big central house. And once in a while, Randy finds a big piece of property and we fantasize about it. But
well, what it brings up a good point, and what Kristin was just saying is the effect that it had on her, just emotionally. What is it that you are hoping that readers come away with from this book? And that's probably a big question, but
it is, and it's pretty simple. I I so revered medicine that I kind of thought, however healed medicine can get me, that's as healed as I'm going to be. And I didn't have a sense of personal agency around my own healing. And so when I was left with all of what I can only really call PTSD from my repeated admissions, I didn't know what to do with it. I didn't know that I could find tools that would be helpful to heal in a more complete way. And so, what I'm really hoping is that it just gives people permission to say, I have power and some agency in my own healing. And it's going to be different for everyone, right? Like, not everyone finds that kind of healing that I did through creative expression or painting or, mindfulness meditation. It's different for everyone, but there are tools that medicine doesn't own, and I want people to seek them.
I really like how you talked about it, that medicine, like what you just said, medicine doesn't own healing, even, that it's the body that heals itself, and medicine is more the scaffolding that allows the body to do its work. And one of the themes in your work for me that really resonates, and I don't even know if you're intending this or if I'm just reading it in, but is that medicine has this almost like a God complex, right? Like if we can't figure it out through medicine, it's not figure outable. And if you come in and you're presenting with symptoms that are a mystery, well, you're a problem. Like, I don't know what to tell you. You seem fine. Why are you here? That's kind of the attitude that medicine comes with, but we do grow up with this like reverence for it, that like the doctors are the ones that heal you. The hospital is the place that makes you better. And for me, there's truth in that, absolutely. Like, I don't want to downplay the really important work that you all do. And also, both things can be true. When I was, in all three of my experiences as a co-survivor, it was the hospital and the people within the hospital who injured. So, what I really appreciate about your work is that it holds both of those things. Like, you can still see your admiration and awe for what medicine can do. And also, you see the gaps and the shortcomings and, where it's maybe inappropriate to give ownership to medicine over things. And there's nothing like that out there. Like your perspective on that is just so unique because of who you are and your experiences, right? As both a physician and a patient. And so I'm getting off of my fangirling again, but that is why I think your work has been so powerful for me, is because you have called out this thing, which is, and I didn't even put this together with the first book, but in this second book, it's that like gap between what whew, don't know if I can get through this, between what you expect medicine to be and to do, and then what your actual experience is sometimes. Um, whew, like I said, you get me every time, but that is the thing with this book that really put words to something that I didn't know how to put words to, but have been feeling this whole time, of like, I almost feel like a little girl, like you were supposed to help me and protect me, and instead you hurt me, and coming to terms with that has been the work that I've been trying to do, this last 6 years or so. And I think, I mean, like I said, I might be reading it into it, but I think that's similar. Like I feel a lot of camaraderie with you in these ways through your writing.
And what you're speaking to, Kristin, on like the co-survivor patient side, the physician's experience and the nurse's experience is moral injury, right? Like
Right.
there are parallels in both of our experiences, and closing that gap so that we can deliver the kind of care that we really want to, that's not, hyper efficient and doesn't leave room for empathy and compassion and real conversations. That's medicine's work, and closing the gap on our own healing is our work. But I think there's so much power in realizing that we're confronting the same thing and we're trying to close the same gap, because if patients and physicians really realized we want that, like, we have so much power.
Right. Yeah, and I mean, this is another theme of your book, is this embodiment theme, right? Of not just you as a patient, but also you as physicians, right? That you're taught, and I watched it happen because I've been along since college, right? So I watched as med school, it started in med school where they just teach you, doesn't matter if you're hungry, doesn't matter if you're thirsty, doesn't matter if you have to go to the bathroom, none of it matters. Ignore your body, ignore your feelings, compartmentalize, and you just are supposed to be this like robot that does a job, right? And so you stop listening to your own feelings and your own bodies. And then, I don't know, just as a spouse of a medical professional, maybe Brandy can, I don't know, maybe this is a female thing, maybe he won't relate, but I've spent the last 20 years or something like trying to remind him that, like, no, you have feelings. Sorry.
Yeah.
Sorry that you do, but it's true, you know? And like, you can't just ignore them, and you can't just ignore what your body needs and just keep going. I'm constantly having to try in very gentle, subtle ways to give that messaging, because you guys are just taught to ignore it.
Well, can I just say something
No.
about that? Well, sometimes
Yes,
I
go ahead.
wonder, you talk about using, you know, other things like painting and, to as a like a way to like process and kind of, work through some of
Mhm.
the things that you've been through. Some sometimes I feel like that's also a way to just like ignore those things. I don't know. You
Mm.
know what I mean? It's too hard to confront like some
He's
of.
talking about himself. He's talking about humor.
Well, no, I mean, but it can yeah, of course I'm talking about that. I'm talking about myself, yes,
Yeah.
but it's I can see how it could be a tool to understand kind of where you're at mentally and how to improve yourself, but also it can go the other way and be like just a distraction from actually getting better. Does that make sense?
Yeah, what you're speaking to is something that it took me a while to figure out, that a lot of those first attempts were still externalizations, like the writing, the painting. It was still like putting it somewhere outside of me to live because it was too hard in my body. And that's why embodiment is such a theme of this book, because medicine, as you rightly said, Kristin, just like beats it out of you. You're supposed to function from here up without any needs. And I had a friend who left a very fundamentalist Christian sect who was like, what you're speaking to is deprogramming. Like, you
Mm.
had to unlearn everything that you were taught about how sick bodies are to be pitied, how your body gets in the way of the work, how your value is really as a laborer that has the ability to, earn. I really had to unlearn a lot of that just to even feel safe enough to kinda go back into my body.
I think with regard to what you're saying, I see how, yes, sometimes it can be a distraction. But I think that it's also, I forget how you put it, but even how you talk about it, it's all very utilitarian. But I think sometimes the creativity, in whatever form it takes, is just a way to process what happened with no goal other than to process it,
Mm.
to look at it, to have to just stare at it and turn it over and bring it into the light and just get comfortable with it, that it's there, that it is part of your story and, part of you. So I don't know. I don't think there always has to be a purpose to the creativity. I think sometimes it just is the way that humans can understand things that are too difficult for language. Like, we don't have language to put around them, so we put art around them.
Do you feel, Will, that humor is a deflection for you? Because I've seen it be really healing for the people who resonate with the videos and see you trying to call out the insurance companies.
Yeah. I mean, from what people have told me, yes, it can be healing. It is healing for others. But I do feel like I kind of allow it to be for others versus for myself.
Let me tell you, this is what he does because I see it's the same pattern. Whenever like somebody calls him, a family member or something, and do like a catch up phone call, and they're like, "Oh, how are you? What have you been up to?" And he'll give them like 2 or 3 sentences, enough to satisfy them for a bit, and then he just immediately turns to, "How are you doing?" Like he just does not wanna have to to talk about his own life, and it's very similar with your humor, I think, of you put it out there and I think you do some amount, especially in the early stuff, you did some amount of, like, processing around all that stuff, but, like, for the most part, you are creating it for others, right? So you're talking about difficult things, but you're turning it around and just being like, "Here it is for you." What do you wanna get out of it?
And if I just keep doing that, I'll occupy so much of my time that I don't have to like Rana, like you just said, turning it inward and really like reckoning with the things inside. So when did you do that? And how did you do that?
I'm just thinking about your life vest video that you made, like, immediately upon exiting
Yep.
the hospital,
right.
man.
Wearing my external
Your
defibrillator.
timeline versus mine are a little bit different.
Yeah.
I knew I had to go back in when I kind of had this, like, panic attack on stage. I wouldn't have called it that at the time, but I think in retrospect, that's what it was. I'm presenting this inspiring story, and I just suddenly saw how it was all a cognitive reframing. It was narrative sense making. It was choosing what was beautiful and offering it to people in the same way you offer the humor, but not the darkness. Um, and feeling those sensations in my body. You know, I remember I like was doing the movement of the sign of the cross that my priest made when I was dying. And just making that movement took me back to that room, and it really caught my breath, and I couldn't breathe, and I started to sweat. And I was like, what am I doing? Like, how am I saying I'm healed, right? And I was in a lot of ways, like the narrative sense making, the writing of the book, the sharing my story, that was so useful. But it was like the surface layer, like the topsoil. And what was really, really dark was still hidden.
Even
So
from
that
yourself, I think.
100%. Like, I literally decided it would be easier to fix medicine than to learn how to live in my sick body. Like, that was
Yeah.
a choice I made. Like, let's just fix medicine. It'll be easier.
Uh, I feel like I resonate a little bit too much
Uh-huh.
with everything you're saying.
Would you like to read this book?
No, I know.
We've got a book for you, Will. I don't know.
I know. I'm almost. I don't know. Because I'm almost scared to read it in a way. Like, and I'm going to. I haven't yet. I've seen little like small parts of it.
Mm-hmm.
I don't know. It's just like
Here's
our
my
stories
question.
are the same but different.
Yes.
But also every time I talk to you, it's difficult for me to not turn you into my psychiatrist immediately.
We have a very comfortable couch.
I know. I feel
that
like
you can come lay down.
Those of you who are just listening, Rana is sitting in her house with I swear it looks like 2 very comfortable therapy like sofas. And so I don't want to turn this into a therapy session, but I am like nervous about like, you know, that transition of turning it into like looking too internally into myself.
Well, and that is a question that I have and have always had, and
Actually,
about you doctor people.
Can we take a break and then
Okay,
ask that
then I'll
question?
ask.
All right, let's take a quick break. All right, we're back. Kristin, you had a question for us, Dr. People.
About, you said that you're nervous to like look inward. And here's my hypothesis. I know that you're taught to ignore your emotions by compartmentalizing. I think you are also taught to fear them.
Yep.
Like what are you, so let's say you look inward and you find some things that are hard.
I don't know if we're taught to ignore our emotions. I think it's more
you're taught to compartmentalize them, to suppress them.
It's just our own feelings are just absolutely not a consideration in anything that we learn.
But it goes beyond that. You have to not let them get in the way of doing your job, right? So you're taught to shut them up.
Okay, yeah, true.
And then not only shut them up in like a volume sense, but like you shut them away in a little box, right? But I think, let's say that you do look inward and you find things that are hard, that make you scared or sad or whatever. That's okay.
That's so funny.
Like, so then you're scared or you're sad and you sit with that and you go to people who can support you.
That we have the capacity to bear it.
That must be the thing.
We don't trust that we have the capacity to endure it. We feel that they are so big they will swallow us and we won't be able to find our way out, that there's a depth of darkness that we won't be able to escape. And part of that's medical training, part of it for us having, I think, survived near death. I don't want to speak to your experience, Will, but like, there's a lot of it that's like, how has my experience hurt the people I love? How has what happened to me changed my child's life? How much responsibility do I bear for their fears? There's a lot that's like heavy about it. And I think all of it feels linked together in this chain that, like, if you pull on it, you don't know where it'll end sometimes. And so starting to do it in a really safe way, like you said, with someone who can keep you safe and baby step your way through it is a beautiful thing to do. I didn't do that because I'm not smart enough to have thought about it at the time. But it would have been a great idea.
So how did you? I was just thinking that. Like, so how did you write this? How did you do that without letting it swallow you whole? And I mean, I assume were you still working? Were you still seeing patients? And and being a parent and a spouse and all the things.
One of the interesting things that I think, I don't really write about it, but the fact that I had this community after writing In Shock that was vulnerable, that could share hard things during COVID, especially, I had those people I could call on really bad days. That started creating a kind of safety net for me. I had my people. And I had tested it out with other things that weren't specific to, how did I hurt my family? How do I live with this fear that I'm going to be dead in 5 years? How do I reconcile the cost of this? Those were harder things, but knowing that I had a safe place was really, really helpful.
So when you're exploring this and putting it on paper and getting into the depths, how did you come out of that? Like, how did you like let light in again?
What it started to feel like, instead of like, I pictured it just being descending into this well of darkness, and it wasn't that. It felt like a spiral that I would pass over the same things with different tools each time. Be like, okay, that time that I died in the OR, and I have such vivid, visceral memories of that time. Maybe the first time I passed through that, all I had was sense making. But the second time, I had a little bit more clarity from my mindfulness work or my embodiment practice of just being with hard feelings or whatever it was. And it became this spiral where I could get closer to it without getting burned. And it got safer to do it. And that was never how I thought about healing. I thought healing was like, you're sick, someone touches you with power, you get better. And instead, it was just this process of getting closer to it and trusting myself differently each time.
Mhm.
And the wild thing is, at the end of all of that, a lot of like the pain I'd been carrying, a lot of the emotional pain, the physical pain, it's just not there anymore. Like I was able to release so much that I'd been carrying that I didn't even know was weighing me down because I didn't have an awareness that it could be different.
Well, you just ruined your anything for your third book then. You there's nothing left, Rana.
I'm gonna do like a cartoon, like it's gonna just be all fun.
The
or
adventures
jokes,
of
stand up. Exactly. There's not gonna be shock in the title. It's gonna be like super light.
So the ideas around just like this assumption, I don't know, assumption is probably not the right word. Maybe it's the right word for me. That like, oh, I'm not gonna live, you know, a normal lifespan. Like it's just at some
Not in the
point it's gonna
cards.
happen, you know.
Yeah, that's how you think about it sometimes.
Yeah. That's not great to do.
Nope. It's not.
And it's like you kinda, I don't know. I would love for you to talk about how it feels living like that. Like what it feels like, how it
Yeah.
kinda impacts
It,
your job, your career.
for me, it kind of colored every single choice I made every day. That like back of my head knowing that like I was probably gonna leave before the end, whatever that meant. It made me kind of hyper attuned to everything. Really, everything felt like the last time, the maybe the last time, right? Kind of in that way that early parenting where you're like, oh, I might never like put them in their crib again. I might never, but it was just like that with everything. I get really, really possessive of my time because I don't know how much time there is. And I really get angry if somebody wants me to do something that I really don't want to do because it's not just about that time, it's about my life. There was a lot of that. I don't know if you feel any of that.
Yeah, I do. And, because, when you tell a story about the time you basically died and came back, you know, the the comment you see a lot is, or the question you could ask is, "Oh, did you appreciate everything so much more?"
Mm.
And I think, I mean, maybe there's some of that, but then, like, there's the anxiety part of it, right? There's the flip side of that, which is
Yeah.
what you're talking about, which is like, it's like always with you, just hanging over you,
Yeah.
like, when's it finally gonna happen?
Yeah.
The precarity of everything is like all you're aware of all the time. Randy tried to get me to meet my husband, tried to get me to meet with a financial advisor who was trying to like plan until I was 90. And I was like, you're hilarious. I'm going to burn through all of it in the next 5 years. Build that into your plan. And he was like, well, like totally uncomfortable. But it's just like these assumptions of like, well, when you're old, I'm like, I did old.
Mhm.
I've done my 80s were in my 30s. I know what it's like. I get it. Like, this is what I know about my life. And it feels so certain that I think it can make people around you uncomfortable too.
Yeah. And it's probably just not a great way to live, having that over you. I
I
don't
mean,
know.
I think if there's data to suggest, and I'm using data loosely because this is actually, when you read this, you will see this is part of your story, Rena, which is that you tell it about how you thought you were going to be dead in 5 years.
Yeah, I was really into my embodiment work. I was starting to have real sort of conversations with my body. I was trusting it differently. I was honoring it differently. I wasn't dismissing it all the time. I was giving it what it needed. And I was in clinic and seeing patients, and I just received this like awareness, message, thought that I would be dead in 5 years. And I didn't know where it came from, but it was undeniable in how true it felt. And I had to decide, like, okay, am I going to trust that awareness or not? And I did the doctor things of like looking for symptoms and trying to weigh it against objective data and trying to dismiss myself. But I did that all really quickly in the clinic room.
Because you're really
I'm
smart.
really efficient.
You're just a great physician.
I'm very practiced at it.
You're so good at
dismissing myself and gaslighting myself. And then I was like, no, I think I need to trust it. And I just sat with that awareness. And I remember I was actually sitting here on my window seat, and it was November, and I was looking out, and it was starting to snow. And I was just watching the snow, had my little coffee in the morning, and all of a sudden the snow looked like these sheets of dividing cells to me. I was like, right, I have cancer. That's what this is. Like the specificity of the timeline, the no real symptoms, but something that could kill me. It wasn't sepsis. I knew it was cancer. And I went looking for it. And when we found it, like, of course, there was the grief associated with a diagnosis like that. I had to tell my child I had cancer. He already had ideas about what that meant. That was hard. But also, it was like, my body nailed it. Like, I was kind of proud of it. Like it knew and it warned me in a way that was useful, which I had never thought about sick bodies as being wise and intuitive and insightful. And it just totally changed how I thought about it. And it also made me feel weirdly protected. Like it was looking out for me and it was going to help me find the way out. And so it's a weird thing. You know, everyone around me was like, I hope it's nothing. The biopsy will come back negative. And I'm like, good luck to you. I know what it is. And you're going to have a hard go of it because I've already accepted it. And I even tried to schedule my own surgery before the path was back. Like, that's how sure I was. Like, I called the OR and they're like, yeah, no, we don't really do that. So
how are your relationship with your doctors?
You're going to have them on one day because that is a whole other story, man. Oh, to care for me. I have so much empathy for these people.
Well, I say that jokingly, but also like kind of seriously too, because
no, it's serious.
Because I know there are so many patients who would hear you say that and like have like have a similar thing. They just know something is wrong.
Yep.
They don't know quite what it is. Maybe can't explain it to their doctors. And like Kristin mentioned earlier, just kind of like, well, all the tests look normal.
Yep.
Like,
and we dismiss it.
And that agency I think is a good thing for people to feel like they have, but it's just taken away from them.
Yeah. What do you, if anything, has that you look at that with your patient brain, and then I'm sure you look at that with your doctor brain, and like most of the people listening to this are going to be healthcare professionals. So what can healthcare professionals take from that? Like, do you have a message for them about that as one of them, right? That because this is your like unique place on earth, as you can speak from both sides so well. I mean, one of your unique places. You have a lot.
and you can also run your own blood gas. So it's like you have a very unique set of skills here.
It.
Yeah. Right.
But like, what do we do about it, I guess, is the question. What do we do as patients? What do we do as healthcare professionals? Yeah. Like, how do we stop dismissing that?
There's so much in our training that causes us to believe that we have to have the answer or we have no value. And I think it really impacts how we talk to our patients. So we're so much quicker sometimes to dismiss something that we can't find validated data for. It's such a different thing to say, and this is, something someone said to me, it sounds like you're worried. And I think we should trust that. And I think we should look into it. Now, looking into it might mean a million different things depending on the situation. I certainly, understand the limits of looking for things that don't have an objective basis. I get patients all the time who have these things that are found on these pan CTs that are done for health screenings that sometimes cause more problem than good. But I think the message for both patients and physicians is there's value in our interoception, in our feeling into our bodies and noticing day to day what comes up for us and honoring it. Honoring it can look different, but we have to start from a foundation of, I will partner with you to look into what this is because I can tell that you're worried.
I think a lot of, if I were to say that to you, you would be like, you're fine, first of all. Then you would try to go like the science doctor route of like,
yep.
You don't, this symptom, you don't have any of these,
What if
if I'm like, I just feel like something's wrong. I can't tell you what, but I just feel like I'm going to be dead in 5 years.
At first, you need to recognize I am an ophthalmologist.
Yes, but it never stops me from, for some reason, always asking you first. Anyway, I think that what you said is a very important bridge word, which is interoception, right? Like that is part of our nervous system. So there's some science for you to latch onto, right, as physicians, that like it's not just some woo-woo thing all the time. Like maybe sometimes, maybe, I don't know, but like sometimes.
Are you saying introspection?
Interoception.
Like
new word for Will.
Yeah.
That's a new word for me.
This is not surprising. It means being in tune with like what's happening. It's how
what's happening inside?
Inside, yes. So you know how
I
you
don't
have
do that.
like your organs, right? You can't feel like you don't have like the right nerve endings on everything to be able to just like feel pain everywhere, right? Like sometimes you just feel pressure or whatever. Well, interoception is kind of like your nervous system is everywhere and it has all sorts of signals, right? And so your body is full of these systems that are designed to do these things that they do. And that is one of the ways they get information about what they need to do, right? So there is a part of our nervous system that is exactly what she's saying of like, something is just off and I can't pinpoint it, but I know it in my bones that it's wrong,
Like, have you ever felt that way the day before you get sick? Like, you're not sick yet, but you're like, man, I just feel kind of run down. It's so weird. I slept well. Is it something I just feel off? My brain's slower. Like, there's something, but you can't tack anything to it. That's all it is.
Yeah.
I learned a new word today.
You did.
It's good.
You can teach us an eyeball word now. It's only fair.
No, it's okay.
Like anyone.
No, we're having such a good time. I don't want to bring ophthalmology into this. How's your clinical practice doing? I'm just, people ask me that all the time, and now I'm asking you because I honestly am, because you've come so far in your own story and healing, and does seeing things that happen in the hospital, in the ICU, like you mentioned PTSD earlier. Like, do you still find yourself, despite all the healing you've done and the wonderful book you've written, do you like slide back into that feeling still, like that darkness, that like are there things that like throw you back into it?
Not as much as I used to. So I would say over these last however many years that I've been healing from everything, I was back and forth in the hospital all the time, right? I've only ever made it like 12 months not being hospitalized in my own ICU in all of this time. That's like my longest run.
Do you get like a punch card?
In your
You get no benefits. It's terrible.
No,
Not even
nothing.
like
Start a
free
loyalty
frozen
program.
yogurt. Can you
Yeah.
imagine? Get a cookie. So at first, like certain rooms in the hospital would trigger me. I would walk past them and like remember exactly what it felt to be inside and have to block it out so that I could care for patients. Certainly the triage area and labor and delivery is somewhere I don't like to go. Certain things about the OR. But that's so much better. And I think my clinical practice now is so much richer because my understanding of what I can bring to my patient's healing has changed. Like, it's so much more for me now about understanding who they are, what they hope for, what a good day looks like, what they're working towards, who they care about, what they want to be able to do when they leave, and then helping to facilitate those things instead of believing like I had to have all the answers and I had to have them at exactly the right moment and I could never have doubt and I could never have feelings about what it's like to take care of someone who's dying. It's much richer.
I prefer when I have a doctor that has, if not the same experience, like something similar where you can relate on some level, right? And I would rather have a doctor that says, "I don't know, but we're going to figure this out. I believe you. I hear you. We're going to figure this out." 100 times over than someone that's just like, "This is what it is." Just because they feel like they have to have an answer. And maybe they're right and maybe they're not, but they're going to send you down a path because that's what they feel like, you know.
But sometimes you still can't find an answer. And
That's okay too.
no, I know that's okay because that happens like frequently.
Yeah.
And
But to feel like
it feels like a failure sometimes
that's
from
what I'm saying. Like from the
the doctor's
patient
standpoint.
perspective, I don't see it as a failure of the doctor.
Right? Because
I
science
just
is
see it
learning
as
new things all the time, right? Like, we don't
exactly
know everything. We can't
right.
know everything. Not everything's been discovered. There are diseases that haven't been named. There are,
Right.
like, the interstitium that Avi Cooper just wrote a beautiful New York Times piece about. Like, we didn't even have a name for that.
Right.
Like, there's so much that we're discovering. So I think saying, like, let's check back in a few months and see how you're doing. And then you get to plot these data points and say, okay, things haven't gotten worse. That's really reassuring. Like,
Mm-hmm.
it's all longitudinal care,
Please,
Right.
please tell me, Renee, that you're teaching like med students, right?
Yeah.
Okay.
And residents and fellows, and I
All
love
right, good.
them.
Can you teach all of them?
The commune. We're back to how we need a
Yes.
commune where we all live all the time.
What's next for you? Obviously, you're going to be promoting Aftershock. Are you like going to be going around and doing a lot of speaking and?
In the way that doctors do, like my friends invite me to give grand rounds at their hospitals, and that's wonderful. And because this book involves art, we're getting to do things with art. So it's very different than like the performative talking that I've done in the past. It's feeling really nourishing, which is like magic. And I don't think I thought that was possible.
Yeah. Speaking of the art, can you talk a little bit about how you decided that was going to be a part of this book and like why?
There were a few reasons. For me, I started painting back after my first really catastrophic illness when I was bedbound, and I had had such a lack of blood flow to my brain that I really had difficulty expressing myself. I had a lot of expressive aphasia and word finding difficulty, and I was having terrible nightmares every night of drowning or not being able to breathe. And I couldn't talk about it, but I could like try to represent it visually. And I noticed that when I did that, like my son or my husband or my mom could look at that and be like, oh, what's that about? Oh, the colors are really dark. Like that feels heavy to me, the way she's like shrouded in black and wearing a protective raincoat and has her little teddy bear. Like, is she okay? Are you okay? Like, it just became this third thing that we could look at together. And it felt useful, honestly. But also for this book, I really wanted to show that there are just other ways of knowing beyond that, like really ruthlessly narrow, limited lens that medicine uses that over prioritizes just cognition and science. There are other ways that we can have things come into our awareness. Art is one of them. Even just, writing about my son's curiosity and the things he would say. Children are so brilliant. And that was really important to me too, to show that like curiosity and wonder can get you further than books sometimes, So it was about redistributing power to other ways of being in the world.
It's beautiful on multiple. I mean, there is art in it, so it is visually beautiful. And then also, like, gosh, your words. Both of you. Why do you have to be so good at everything? God. Leave some for the rest of us.
Well, I appreciate you including me.
And
right? That was a close one.
I read some great scripts between surgery and anesthesia.
Well, I never accused your writing of being beautiful, but you are good at the skits, I guess. Here's what I want to know. When does Walt write a book? Because I will buy that today.
He roasted me at the book launch.
Did he really?
Yep. I'll send you the video. It was,
I would love it.
It was brutal. He brought up the time that I stabbed a fellow with a plastic fork in the forearm and asked everyone, ask yourself, is that the work of an empathy expert? It was brutal.
Wow. How old is he now?
So 15. I think stand-up comedy before he writes a book.
Yeah. Okay. Well, I mean, I'm one of many, I'm getting in line here, but big fan of whatever Walt's going to do. I'm going to want to watch that.
Get him started in stand up, and then I can have an open for me. A couple shows.
There you go.
It's going to be fantastic.
Road show.
Can't wait. Well, all right. So the book is Aftershock: Learning to Reinhabit My Body After Illness. There it is right there. And we have our copy right here.
We have matching copies.
The audiobook is I'm not an audiobook person, but you're enjoying that. Did you, is it Rena? Is it?
She does the beginning and the end, like the notes of the readers. And then there's a note to healers at the end. Yeah. She reads those.
You didn't do the whole thing? How is that decision made?
When I think about having to do like Randy's voice and like I'm out there are professionals. This is their like vocation. They're good at it. Like, what the hell would I do?
You do what Randy said.
Can you imagine?
That's what you would. That's what I would do.
It would be terrible.
Yeah.
That might cause some interpersonal conflicts.
Exactly.
I think, in your life. Well,
leave it to the professionals, man.
So, I definitely encourage people to check out, go get the book. I mean, all the things we've discussed, I think so many people can relate to.
Yeah, even if you haven't been a, critically ill patient, I think just if you're a human being,
right,
the themes in both of your books really are for you.
In shock, aftershock, and then I can't wait to learn how you're going to name the third one. So, is there a pre-shock? Can we do a prequel to
oh my God, like
In
Star
Shock?
Wars?
Episode 1. Return of the Shock. Okay.
Oh man.
Rena, thank you so much for joining us. And
thank you.
Please,
it was so fun.
Please keep writing and talking and creating, and you heal people. You healed yourself, and I keep learning from you as well. And if you need your first therapy patient.
Yeah.
I know you're not
I'll send him to you.
a trained professional in that discipline, but I'm willing to overlook that.
I'm willing to wing it.
Yeah.
We'll make it work.
And I would like to see that session.
And people can find you on social media as well. So just search your name, Rana Awdish, and
these were like heavy topics we're discussing today, but also you are hilarious, and your stories are hilarious. Like you're just like you're so well rounded.
And come back before you write another book. I'd love to talk some more.
I will not write another book just to get on, but I will come.
All right. We'll see you later, Rena. Thank you. I told myself I wasn't going to turn that into a therapy session.
I think you should have.
Even
more.
She has a way to I don't know
very,
what it is.
Warm, but also dark.
Magnetism for just telling your inner pain and secrets.
She could be very dangerous if she ever chose to be.
Oh my goodness! What fantastic! Just a fascinating her story. We didn't go into details about the origin of where this book came from. Mm-hmm. Basically the in-shock story.
Right.
But definitely check that out. A lot of health issues and just to put it mildly.
Yeah.
And so definitely encourage people to everything she writes, not just the books, but the op-eds. And
yeah, she is a brilliant writer, and she has, a really good brain and also really unique experiences. And so the combination of all three of those things makes for incredible. Like, it should just all be required reading, I think.
Let us know what you think of the episode. knockknockhi@human-content.com. Thanks to all the great listeners leaving feedback and reviews. If you subscribe and comment on your favorite podcasting app or on YouTube, we can give you a shout out. Like we have Medlines on Spotify said, "Thank you for interviewing Heather. She's an amazing doctor and advocate for her family."
Heather Gatcombe.
Yeah.
Their son has mitochondrial disease, and they have a really incredible story as well.
They love good stories.
Yeah.
They've had a good guest come on with lots of great stories. Really appreciate those. Something we can learn from. Full video episodes are up every week on our YouTube channel @GlockenFleckens. Go check that out. We also have a Patreon, lots of cool perks, bonus episodes, react to medical shows and movies, hang out with other members of the Knock Knock Hi community. We're doing more in there lately.
Mm-hmm.
It's been a lot of activity. It's great. Interactive Q&A, live stream events, much more. Patreon.com/GlockenFlecken or go to GlockenFlecken.com. Speaking of Patreon community perks, new member shout out to Melis A and Bob C. Welcome, you guys. Shout out to the Jonathans, as usual. Lucia C, Edward K, Marion W, Mr. Granddaddy, Caitlin C, Brown L, MP Cole, Tracy B, Mary H, Keith G, Parker, Muhammad L, David H, Kaylee A, Gabe, Eric B, Marlene S, Scott M, Kelsey M, Dr. Hoover, Sean M, Ryan N, Jess K, Hawkeye M D, Bulbasaur, and Shawnee D. Patreon roulette time. Random shout out to some of the emergency medicine tier. Shout out to Heather B for being a patron. Thank you all for listening. We're your hosts, Will and Krista Flannery, the GlockenFleckens. Executive producers are Will Flannery, Krista Flannery, Aaron Cordy, Rob Goldman, and Shanti Burke. Editor and engineer Stacey Portizo. Music is by Omer Ben Sweet. To learn about Knock Knock Hi's program disclaimer, ethics policy, submission verification, licensing terms, and HIPAA release terms, go to GlockenFlecken.com or reach out to us, knockknockhi@human-content.com with questions, concerns, or fun medical puns. Knock Knock Hi is a human content production.
Goodbye.
Thanks for watching the episode. You can find more on that playlist over there. If you prefer to listen or you just had your eyes dilated, you can binge full episodes wherever you get your podcasts. Or join the party over on Patreon, where you get early access episodes, hang out with us, get lots of exclusive bonus content. Help you subscribe, leave a comment below. Let us know what you think.